Prostate cancer is back in the headlines after the passing of Dexter King and Ryan Sandberg, recently diagnosed. And today we're discussing that with our 9 health expert, Dr. Pyle Coley, because it's one of those topics, like many, and we often say this, men tend to be pretty private about their health concerns and needs, but prostate screening also is so critical.
It is, and what upsets me is that prostate cancer is not a cancer we should be losing people to, because it's a slow-growing cancer most of the time. It's indolent, which means you should die with it, not from it. And if we did a better job of screening more aggressively, especially in Black Americans who are higher risk, we would hopefully prevent these types of deaths.
Dexter King was, what, 62?
He's very young. Ryan Sandberg, certainly a younger man,
64?
being diagnosed with it.
Right,
but yeah,
right. And metastatic, which means it's spread and it's going to have a limited life expectancy.
So I always worry about the job of screening falling to insurance companies as opposed to health professionals and or people who want to be screened.
Yeah.
Ages for screening, things have changed, things have gotten better, people have become more aggressive, but you say we're still falling well short.
We are, and part of the problem is there's a controversy around whether we should be screening. So the way that we screen people is using a blood test called a PSA, prostate-specific antigen, which is a little protein that only comes from the prostate. The problem with it is that it can be non-specifically elevated. So if you have an enlarged prostate, for example, which men get when they get older, BPH, that can go up. If you have a prostate infection, it can go up. So there's a lot of false positives or fake outs. So people are saying when you start implementing a test that gives false positives on a population level, you're doing unnecessary procedures. But the other side of that is if you can find a marker early and catch it, you could find that microscopic cancer before it spreads and actually treat it aggressively.
It reminds me a lot of what we hear with breast cancer all the time. There's no perfect science or perfect screening for breast cancer, and yet we always are saying, but it's the only thing we got.
Right. But I think we're making progress with prostate cancer. And there was a study out of Europe that looks at using MRI. So why are we only in 2024 using blood tests when we have access to imaging technology that can also look at the prostate? And what it did is it actually looked at people with their PSAs, and people who had normal PSAs turned out to have prostate cancer, because that cancer has to really be spilling that antigen over into the blood cells. So it's that maybe you don't do one or the other, but do them both together, potentially, and you increase the sensitivity, you pick up more cancers, and the specificity, because the MRI will tell you if it's just an enlarged prostate and not a cancer, and you're avoiding that unnecessary biopsy.
Well, there's also the digital exam that was the cause of much humor, but also, you know, it's a tension and it creates a moment in the office for men and their doctors to get together. But that's pretty much gone by the wayside now.
Yes, so this is called the DRE, the digital rectal exam. And I remember when they were teaching it to us in medical school, they said the prostate should feel like the palm of your hand when you put your finger in the rectum. And if it feels like a knuckle, that's a mass or a nodule. The problem with that is, again, for something to feel like a knuckle, feel hard enough for a physician to feel it, palpate it, it has to be large enough. So you're not picking up the early smaller cancers that, again, might have microscopic changes, start to look abnormal. You're really waiting for them to become nodules or tumors before that picks it up.
So your recommendation for the age you should start, and also what if you have a family history?
So 45 for most men, they should start talking to their doctors. And we talk about, obviously, the PSA test. We also potentially can use MRI as a complementary modality. Here, the insurance companies don't cover the MRI as much as they do in Europe. But if you have a family history, you have risk factors, or you're Black American, you may even want to start screening potentially earlier. Again, depending on the risk benefit, knowing that some of these could be fake outs, but also knowing that we shouldn't be losing men to prostate cancer.
Well,